I am going to speak plainly because too many older men share the same quiet regret. They waited. They wrote off night trips to the bathroom, a hesitant start, or a weaker stream as the price of getting older. Years later, they learned that early action would have protected sleep, intimacy, and in some cases, kidney function. Today, I will share with you the lessons men wish they had heard decades earlier, grounded in the actual behavior of the prostate, bladder, blood vessels, and nerves. If any part of this helps you or someone you love, subscribe so we can keep building your health confidence together. To set the stage, let us replace fear with facts so choices feel lighter. The myth says decline is automatic and nothing changes the path. The truth says age brings biological shifts, yet momentum can still be redirected. When you reduce pressure on the bladder outlet, protect blood flow, and calm inflammation, symptoms often ease. And dignity returns to daily life. First, notice the quiet messages and respond before they grow loud. A pattern of urgency waking at night to pass urine delayed start a thin stream drips after finishing or the sense that the bladder did not empty are early signals that the channel running through the prostate is tight or irritated. When the outlet narrows, the bladder muscle has to push harder. Over time that muscle thickens and then tires, which is why urgency and night waking can rise together. Early attention prevents that spiral and saves months of broken sleep. Next, understand how the gut can crowd the pelvis and stir symptoms you think are only from the prostate. When stool accumulates, the rectum becomes a firm neighbor pressing on the bladder and the prostate. That mechanical pressure narrows the urinary channel and irritates the bladder wall. Regular, soft stools without straining reduce that pressure and often cut night waking tangibly. Build meals around vegetables, beans, lentils, fruits, and whole grains that suit you. Drink water throughout the day and move after meals. These are simple acts that change life at 2 in the morning. After that, look inside the medicine cabinet because some everyday products quietly tighten the outlet or dull the bladder's squeeze. Decongestants used for colds act like stress hormones on the smooth muscle at the bladder neck and can make starting the stream harder. Older-style antihistamines and drying agents can weaken bladder contractions and increase the leftover volume after you void. Certain mood medicines and muscle relaxers add to the slowdown, and pain medicines that slow the gut intensify pelvic pressure by worsening constipation. A 15-minute review with your clinician and pharmacist often removes one hidden culprit that made winter miserable. And because metabolism and inflammation drive growth signals, metabolic health works in your favor. Central weight, high blood sugar, and low activity are linked with faster gland growth and more urinary symptoms. When insulin levels run high and the waistline expands, inflammatory signals rise in many tissues, including the prostate. A practical plan beats perfection. Walk briskly on most days, add 2 short strength sessions each week, and build plates that favor vegetables, legumes, fruits, whole grains that you tolerate well, lean proteins, and olive oil. You are not chasing a magazine body, you are easing pelvic pressure and protecting the vascular system that supports sexual function and sleep. Before worry takes over, separate common enlargement from cancer so decisions can be calm. The most frequent reason for a weaker stream and night waking with age is non-cancerous enlargement of the central prostate. Even so, new blood in the urine, unexplained weight loss, bone pain, fever with urinary discomfort, or a sudden change in pattern deserve timely evaluation. Most findings have more than one cause. A short visit brings clarity and replaces months of quiet dread with a clear plan. Meanwhile, build control from the ground up by training the pelvic floor correctly and gently. The pelvic floor is a muscular sling that supports the bladder and helps you modulate the stream. When trained well, it reduces urgency, post-urination drips, and recovery time after procedures. While breathing normally, imagine preventing gas and gently lifting the base of the pelvis. You should feel a subtle inward lift without squeezing the buttocks and without holding your breath. Begin with 5 easy holds of 5 slow seconds, rest for 5 slow seconds between holds, and complete that set 3 times per day. Over several weeks, many men notice steadier control and fewer leaks after finishing. If you feel pressure in the lower belly or a headache from breath holding, ease the effort. The right dose is gentle. And since sleep is a pillar of health, shape evening habits that let the bladder rest. Push most fluids earlier in the day and taper after late afternoon. Keep caffeinated drinks and alcohol away from the evening because both irritate the bladder and fragment deep sleep. Empty the bladder twice before bed with a brief pause between. If ankles swell during the day, lift the legs in the evening so that fluid shifts back before you lie down rather than after you fall asleep. A calmer night follows a quiet evening plan. For sexual health, treat erection changes as a vascular signal you can improve, not a verdict you must endure. Reliable erections depend on healthy arteries, responsive nerves, and relaxed, smooth muscle. High blood pressure, high cholesterol, and high glucose stiffen the vessel lining and limit blood entry. The first sign is often less reliable firmness or weaker morning erections. That is a cue to treat vessels like the engines they are. Walk most days, favor plant-forward meals, keep a steady bedtime, and discuss targeted treatment for blood pressure, lipids, and glucose that fits your situation. Medicines for erections work better in a healthier body, and the same vessel care protects the brain, the heart, and the kidneys. If urgency and leakage are wearing down confidence, shift the frame from blame to mechanics and nerve patterns you can train. The common pattern with age is an overresponsive bladder plus a narrowed outlet. Bladder training, gentle pelvic floor practice, and a careful medication review reduce episodes. If leaking continues, ask for pelvic floor physical therapy. A skilled therapist corrects common mistakes quickly and replaces years of frustration with practical progress. Screening also deserves a deliberate personal conversation rather than a rushed decision after a scare. Prostate-specific antigen is a blood test that can find cancer earlier, yet it can also detect slow-growing cancers that may never cause harm. That means the decision to check and how to respond to the number depends on age, overall health, family history, ancestry, and personal preferences. Values can rise for reasons other than cancer, including infection, vigorous exercise, or ejaculation. A calm discussion that covers both benefits and trade-offs is worth your time long before symptoms push you into urgency. Now, I know that bathroom technique sounds trivial, yet it changes outcomes in a real way. Sit if that helps the pelvis relax. Give yourself time without straining. If you feel finished and then experience a drip, stand and shake gently. Sit again, lean forward a little, and wait to see if the bladder releases a small remainder. This double voiding helps finish the job without force. Patience protects the pelvic floor, and patience protects sleep. Pain or burning with urination is a different problem than simple obstruction and deserves its own lens. A sudden burn when you pass urine, fever or chills, or deep aching between the scrotum and rectum point to inflammation or infection. Dehydration, long hours on a hard surface, or a long bike ride can also irritate the region and mimic infection. Most episodes settle with fluids, rest, and time. Severe pain with an inability to pass urine is not a moment to wait. It is a moment to seek timely care so relief and answers arrive together. Now look inside the gland so treatment choices finally make sense. With age, cells in the central prostate respond more strongly to a locally made hormone called dihydrotestosterone. That hormone nudges both gland cells and supporting tissue to grow. Growth creates a static squeeze on the urinary channel. At the same time, the smooth muscle lining the channel can stay overly tight, which is the dynamic squeeze. The bladder above adapts by pushing harder and later becomes irritable and less stretchy. That is why men can feel both a weaker stream and a stronger urge. Understanding these levers lets you match a plan to a pattern rather than guessing. Medical therapy rests on 3 levers, and matching the lever to the pattern is where progress begins. The first lever relaxes the channel by calming smooth muscle at the bladder neck and inside the prostate. These medicines often improve hesitancy and flow within days. Lightheadedness, a stuffy nose, and a change in ejaculation can appear, so a low starting dose and a cautious first week help. The second lever shrinks the gland by blocking the enzyme that creates dihydrotestosterone. This route is best when the gland is larger or when the prostate-specific antigen is higher and it takes months to show full effect. Lower sexual desire or changes in erection quality may appear in some men, which is why an honest conversation upfront matters. The third lever uses a daily low-dose medicine that improves urine symptoms and erections by relaxing smooth muscle and supporting pelvic blood flow. This group does not mix with nitrate drugs prescribed for the heart and can lower blood pressure, so coordination with your clinician is essential. Many men with larger glands do best with a combination that relaxes the channel now and shrinks the tissue over time. And here is a tricky problem. Sometimes the bladder, not the prostate, is the loudest voice, and the treatment should reflect that difference. When urgency, frequency, and night waking dominate while the flow remains reasonable, the bladder muscle may be over-responsive. Medicines that calm the bladder can help in this pattern. One group works by blocking receptors that trigger bladder squeezing. Dry mouth and constipation are common trade-offs, and memory effects can appear in older adults, so careful selection and dosing matter. Another group helps the bladder hold more by a different pathway and is often easier on the memory. A small dose from this second group can be paired with a channel relaxer when appropriate. Before adding bladder calming drugs, clinicians often measure the leftover volume after you void. A very high residual suggests obstruction and raises the risk of retention, so that quick check makes the plan safer and more precise. Evaluation is simpler than most imagine and clears up confusion fast. A careful story comes first, including day and night patterns, fluids, caffeine, alcohol, constipation, medicines, and sleep. A brief exam follows. A urine test looks for blood or infection. Blood tests can check glucose and kidney function when appropriate. A quick bladder scan after you void measures the residual volume because a very high number points to a blockage that should be addressed. A simple flow study can show the speed and shape of the stream. When blood appears in the urine, pain suggests stones, infections return, or a different cause is suspected. Imaging or a look inside the channel may be added. The goal is to match the mechanism to the treatment so time and energy are not wasted. There are two numbers from that checkup up often guide the path forward. Post-void residual is the amount left after you finish. When that amount sits around 200 milliliters or more, obstruction becomes likely, and the plan shifts toward opening the channel. The yearly risk of an acute blockage if you simply watch and wait with advancing symptoms sits in the low single digits and climbs with larger glands and slower streams. Knowing these numbers moves choices from guessing to grounded judgment. Now, let us discuss the fact that sleep apnea and nighttime urine production are linked through a potent hormonal signal most people never hear about. When breathing repeatedly stops and starts during sleep, pressure swings in the chest signal the heart to release a hormone that tells the kidneys to make more urine. That is why men with loud snoring and pauses often fill their bladder faster overnight. Treating sleep apnea dials down that signal, reduces nighttime urine, improves blood pressure, and lifts daytime energy. If a partner notices loud snoring or pauses, a sleep evaluation pays off in steadier nights and quieter mornings. And of course, waist size is not only cosmetic, it changes hormones and inflammation that shape pelvic health. A larger belly shifts hormone balance, raises insulin, and increases inflammatory signals that affect both the prostate and the bladder. Trimming the waist by even a small amount reduces pressure on the pelvic floor, calms the bladder, and lowers night waking. Pair regular walking with a simple strength circuit and a plate centered on plants and lean proteins. Over months, the pelvis rests and confidence returns. Plant extracts are common talking points, so let us keep the advice balanced and precise. Saw Palmetto and various blends are widely used. Research is mixed and any improvement tends to be modest. These products can still interact with medicines that thin the blood or lower blood pressure. Medicines that block the enzyme creating dihydrotestosterone can lower prostate-specific antigen values by about half, and some plant products may also lower measured values. If that change is not known to the clinician, it can mask a meaningful rise. If you choose a trial, set a clear window and track one practical measure such as fewer night trips or easier starting. If nothing changes, stop and protect both your wallet and your liver. When medicines and habits are not enough, modern procedures offer a stepwise path matched to personal goals. Options that lift or separate the tissue and open the channel without removing it can help men with smaller to moderate glands and often preserve ejaculation. Options that use water vapor energy or other focused energy shrink the tissue from the inside over several weeks and can suit men who prefer to avoid a larger operation. When blockage is severe or the gland is very large, removing the obstructing tissue through the channel remains the standard, now performed with better tools, less bleeding, and quicker recovery than in prior decades. Choice depends on the severity of blockage, any history of retention, infections, stones, or kidney strain from back pressure, and what matters most to you regarding sexual function and recovery time. A clear discussion of trade-offs beats any sales pitch. Moreover, acute urinary retention deserves a plan before it happens, so fear does not run the night. When a man cannot pass urine and the lower belly becomes tight and painful, relief begins with drainage using a catheter and then a targeted plan to prevent a repeat. In many men, the root cause is non-cancerous enlargement. Treatment afterward often includes a medicine to relax the outlet and a conversation about a definitive procedure if the blockage is significant. Knowing this in advance replaces panic with steps you can follow. Now, let's move to cancer grading. A pathologist studies the pattern of cells under the microscope and assigns numbers that describe how much the pattern still resembles healthy prostate tissue. Two patterns are added to form a score. Lower scores often map to slower behavior and a wider range of options, including careful monitoring in the correct context. Higher scores signal faster behavior and call for a more assertive plan. At this point, you hold the levers that men in their 70s wish they had learned in their 50s, and each lever points to a specific action. Ease outlet tension by replacing medicines that tighten the channel when a safer alternative exists. Calm an overresponsive bladder by fixing constipation, timing evening fluids, and practicing a gentle pelvic floor lift. Protect blood vessels so erections and pelvic circulation remain strong. Match medicines to the real mechanism rather than guessing. Use subjective checks like post-void residual when the picture is not clear. Consider procedures when blockage or complications persist and decide based on the outcomes that matter to you. Now add your experience to the knowledge of the group so others can take the next step with confidence. Leave a comment with the single change that helped you sleep better or regain control. Real-world notes from real people turn advice into action for someone who needed to hear a voice like yours. If this steady, clinical approach to prostate health helped you or someone you care about, subscribe so you never miss the next clear lesson, and share a second comment with the one topic you want covered next so we can build this channel around your real questions.